again. So I want to cover off on the third group to discuss in terms of medications that treat heart failure. These are what we call the mineralocorticoid directed drugs. They are directed against the adrenal hormones. A typical example of an MRA is something like spironolactone or aldactone. It's been around for a very, very long time. It's used for a variety of things like lowering blood pressure or as a mild diuretic. Some people use it to treat conditions like polycystic ovarian syndrome or PCOS, again because of its anti-androgen effects. And there's also a drug called eplerenone, which is a perhaps newer generation of this same kind of medication, more a drug that's been developed in the modern era. One of the possible side effects from the spironolactone is, if you're a male, is possibly swelling in the breast tissue, and that doesn't seem to happen with eplerenone, so that can be one of its advantages if you happen to be suffering from that. But these are good drugs. They've been around a while, and they can make a substantial difference to actually how you feel, in that they can have some benefit on how you feel. They do cause some fluid loss. They're not a strong diuretic, but they can assist in combining with other stronger diuretics such as furosemide or Lasix, and this in turn can have what we call a synergistic effect with the two used together quite well. The other benefit of the spironolactone or eplerenone is that it conserves some of the electrolytes like potassium, and you lose bucket loads of that when you're on things like furosemide or Lasix or Urex, which is all the same type of thing. So then, your doctor might be feeding you lots of potassium to supplement what's being lost, and magnesium is the other one that's really important. The spironolactone helps spare some of those electrolytes so that you aren't losing them all the time, and this can be very valuable. So that in combination can work really well. And the spironolactone has, or that group of drugs have been shown to reduce number of hospitalizations for heart failure, and definitely improve symptoms, unlike the first two drug groups we discussed, ACE inhibition and beta blockers. So this one has actually been a good addition to the lineup of therapy in heart failure, and it really historically was kind of the third major group that we would tend to add in after the ACE inhibitors and the beta blockers. I still use a lot of this. This one is particularly useful in the HFpEF variety of heart failure. It's definitely been proven of value in HFrEF and been used for that for a long time. There are less things that have been proved valuable in heart failure with preserved ejection fraction, so the one where the heart pump still squeezes pretty well but maybe is a bit stiff and doesn't relax. That one, there's not so many drugs that have actually been proven to be of benefit, but the spironolactone is one that's actually helpful in that condition. So this is a drug that I will often use. One of the caveats, if you like, or cautions, is if there is a severe amount of kidney failure or high potassium for any other reason, then you would either need to avoid the use of this drug, or perhaps you would use it with a very small dose and with care. But again, this is something that needs to be decided by and directed by your treating doctors and specialists, and is important to monitor with blood tests so that it is done safely. But yeah, this is the third probable group to consider in managing heart failure, and so hopefully that helps you understand it a bit better. Again, these videos are for education purposes only. They do not replace you seeing your doctor and getting particular specific medical advice from your treating doctors and specialists. They're here to help you understand the choices made or the options you have available, and to then discuss those with your doctor as well. Okay, so join me for the next video, and we will talk about the next group of medications that can be used in heart failure and why.